Sup everyone, welcome to our presentation on summary feedback. My name is Jarek and I will be joined by the rest of Team Orange, Jed, Crystal, and Dustin to talk about something called summary feedback. In this episode, we will talk about what summary feedback is, examples of summary feedback, and 4 different research articles on how summary feedback affects motor learning. Before we get into the meat and potatoes of this topic, I wanted to define what is summary feedback. Summary feedback is the summary of a participant's performance after their entire task is completed. This feedback has to be given after the whole task is completed to be constituted as summary feedback. With that being said, let's move on to some real-world examples of how this feedback is used. So examples such as sales reports, game film, and transcripts are key examples of summary feedback. For our first example, sales reports, salespeople use reports to analyze their performance after a given time frame. For our second example, we got game film, as athletes analyze game film from over their past couple games in order to improve for their next game. These film sessions are often supervised by a coach who gives feedback. And lastly, report cards and transcripts is something that we're all familiar with, as teachers and admins take note of all your grades throughout their semester and combine them all into a document that showcases how you performed in every single class. And as you can see, all 3 of these examples require analysis after something has occurred. Transitioning over to our first research article, I will talk about the effect that summary feedback has on experienced lifters. The article that I chose dives into the world of powerlifting and the importance of bar path kinematics. When it comes to lifting heavy weights, strength is not king, but rather technique. Researchers suggested that alterations in lifting technique has a direct correlation to how much weight is able to be moved. With this knowledge, the testers questioned how the lifters performed with the input of a strength coach versus relying on their own knowledge. The focus of this investigation was to see if summary feedback from a coach affected the future performances of already experienced athletes. After the completion of the study, the consultation provided by a coach using detailed analysis was found to greatly improve the bar path of each participant in the study, even if they were already an experienced weightlifter. This shows that summary feedback is useful for all levels of experience. With that being said, I will now hand it off to Jed for his article.
So the full name of my article is Remote Synchronous Laceration Repair Instruction with Summary Feedback. And the gist of it is that basically one school in the Midwest decided to perform a study about the perceived effectiveness of remote learning by analyzing a specific workshop that was held in response to the strict guidelines during the COVID-19 pandemic. There, 35 family medicine residents underwent a remote laceration repair workshop that was synchronous, but the final performance was graded asynchronously. So basically, the students were all on Zoom at the same time to practice and watch demonstration by the instructor, but they were required to submit either photo or video of their final work, where they would then receive asynchronous summary feedback on their entire performance. The overall results of the workshop were very positive, as the average score among the students was 95%. Also, the students' self-confidence in the techniques greatly improved, as every question in the given post-test evaluation saw statistically significant improvement as well. When comparing the workshop and summary feedback to previous in-person lessons with real-time feedback, all but one of the participants categorized them as equal to, better, or much better than any past training that they received.
So my article was about how feedback could be used in the clinical setting specifically for patients and their treatment plans. Of course, to determine which treatment is best for a patient, some sort of feedback is required. The study created patient-personalized and summarized feedback of 60 randomized trials looking at the effects of massage and yoga versus normal care such as physical therapy for chronic lower back pain, which was then presented back to the patients to help them decide which type of treatment they would rather have. This was done in contrast to the normal method of either just asking the patients how they felt after each trial or session, or just having the medical professionals decide which treatment they would recommend for a more patient-centered approach. A majority of the sample group, 59%, actually said that the summarized report actually helped them change the way they managed their back pain, and 70% found it easy enough to understand that they didn't need any additional discussion of their results.
Hi, my name is Dustin, and my article was about comparing summary feedback with concurrent feedback to determine which style would be best in teaching an elderly population novel skills with the purpose of rehabilitation or physical therapy. Researchers gathered 90 participants between the ages of 61 to 88 and instructed them to walk using a walker with the goal of learning to place limited weight on their dominant leg. The study was conducted in 10 trials total, 5 for an acquisition phase and another 5 for retention. Concurrent feedback was recorded via sound cues during the test, whereas summary feedback was recorded after the 5 trials. Both groups used this auditory feedback, which was given via a special testing shoe that beeped if the patient's weight placed on their dominant foot went above 80 pounds. For the summary feedback group, in order to limit this auditory feedback, they utilized earplugs. The result found that while no significant difference existed between the two groups during the acquisition phase, retention was highest among the summary feedback group. What this informs us is that utilizing summary feedback in a physical therapy or rehabilitation setting is best for developing lifelong skills.
Alrighty, that's all that we have for you today. And as for Jed, Crystal, and Dustin from Team Orange, I'm Jarek, and I would like to say thank you for listening to our presentation on summary feedback. Take care and goodbye.